Namaste. I am going to speak on psychological aspects in palliative care. Faculty for this topic is Dr. Professor D.P. Gupta. He is MBBS, MD and CCPC from AIIMS, and he is President of Cancer Aid Society. Psychosocial care as defined by the National Council for Hospice and Specialist Palliative Care Services is care concerned with the psychological and emotional well-being of the patient and their family and their caregivers, including issues of self-esteem, insight into the adaptation to the illness and its consequences. Communication, counseling is very important in addressing the psychological aspect of the patient. It is a form of the care that encourages patients and to express their feelings about the disease, while at the same time providing ways by which the psychological and emotional well-being of such patients and their caregivers are improved. Physicians, nurses, social workers, psychological counselors, these are the people who can address this psychological issue of the patient as well as caregiver. They can address the psychological, emotional, spiritual and social issues of these patients. There are many diseases in our society which has a social stigma, and cancer is one of them. It is society's negative evaluation of the particular feature or behavior of certain individuals. It is a great concern with cancer patients and persons with other deformities. Such persons had to face many inappropriate reactions from the society. Because of social stigma, sometimes these patients are isolated from the society, they cannot take part in the social gathering and cannot mix up with their relatives also. These reactions are generally from the close associate. Sometimes family members isolate the patient, they do not come in contact with the patient and they refuse to stay with the patient. We have incidents where the patient wife has abandoned the patient because he has developed cancer. How to face social stigma? Patient can successfully cope with social stigma when he is singled out. First, you have to identify such patient, find out the reasons why he is suffering from social stigma or why he is having some psychological issue because of that. So, social stigma should be identified and psychological counseling should be done for these patients. To overcome social stigma, social workers are of great help. Other people who can help these patients are psychologists, and even psychiatrists are helpful to this patient and their family. Social workers may increase medical knowledge of the disease. They tell the patient and family about the disease, its consequences, its reality, make them accept the situation and make them and empower them to take decision about their disease and their treatment. This will help in building a good interpersonal relationship amongst the patient and family. A team of social workers, doctors, nurses and psychological counselors can have a open communication and discussion with the patient and family members, and this will help in removing the fear from their mind. It will help them to opt for the good treatment options and also to mix around with other family members, society and friends. Medical information can be given by print and electronic media and by organizing of the workshops and seminar. We can make a group of these patients and address their issues by group counseling, group discussion and by sharing the information about their disease. First of all, any cancer patient, when he is told that he is suffering from cancer, he is likely to go into the phase of denial. Cancer has got such a impact, psychological impact on mind of the patient, that patient out of fear, out of anxiety or many other reasons, they do not accept this fact, and because of that these patients go from one doctor to another doctor and they do not accept the diagnosis, and hence they waste so much of time initially in the diagnosis of the cancer and its treatment. This is why in India almost more than 50% of the patient who attends cancer hospitals are in stage 3 or 4 of the disease, and where sometimes the disease is so much progress that treatment is not possible and you can offer only palliative care only. They avoid the reality of the illness. In many cases, they avoid this terminology itself. They believe that something will happen, some miracle will happen and their cancer will be cured. Some miracle will happen and it will turn out that it is not cancer and something very simple diagnosis or a simple disease which will be cured. So, this is the phase of denial, and here patient and family needs to be counseled. Sometimes patient out of fear of leaving their habit, they do not accept the disease, like patient of cancer lung. Since they have to stop smoking, they will not accept this diagnosis and they will continue smoking. So, this is the dilemma of cancer patients. Denial is the one thing which comes in way of the diagnosis and proper treatment in time. So, it is very important to do breaking bad news. We call it breaking bad news when we tell the patient that you are suffering from cancer. And so, it is this particular dialogue with the patient and family is very important, very crucial, very sensitive, and one has to be prepared. Even the physician as well as patient and family should be prepared for this type of dialogue and discussion. So, before doing breaking bad news, it is important that a person giving bad news is the right person, like a doctor or a highly experienced nurse or a sometimes family physician. The person who is delivering this news, is he having enough information about the patient diagnosis and its investigation and his problem? Then breaking bad news should be done at right time and place. You have to previously you have to tell the patient and family, take a appointment of them and give a proper time slot for this discussion. And it cannot be given in a crowded place. A proper designated place or area should be defined for this breaking bad news, where there is enough privacy, there is no disturbance from other sources, and patient and family can be given full attention. Does anybody else too needs to be present? You have to be sure whether this breaking bad news should be done only to the patient and family, or they want some friend also to be there. So, arrange all this with the discussion with the patient. Person who is doing breaking bad news should also have some information about the future treatment plan of the patient. So, he can properly address the question from the family or friend or a patient. Only few patients will be bold enough, or family member will be bold enough to say that, okay, tell me all, whatever I am having, whether I am having cancer or whatever stage it is, tell me all. But still, the person who is doing breaking bad news has to do stage wise, slowly, one thing at a time, and in very sensitive manner. And one should be very specific. You need not tell lies to your patient. You should be very specific about the diagnosis, about the treatment option. There should not be any misunderstanding between person who is doing breaking bad news, a physician or a patient and family. Before doing breaking bad news, one should keep in mind, one should be very sure whether you want to tell this directly to the patient. Many a time family member wants that this diagnosis should not be told to the patient. Family member will say, tell the diagnosis to us first and then we will tell to the patient. One has to respect this request of the family member and do accordingly. What will happen if family member hides this diagnosis from the patient? So, you should evaluate the psychology of the patient and family member as well. Many patients are bold enough and they want to know about their illness. In spite of that, if it is not told and family member hides the fact from the patient, then this gives very bad psychological impact to the patient, and then he may go into some psychological problem or depression. Sometimes patient may be angry with the family who knew about the disease and did not think proper to tell him. Many times family does not want to tell the truth to the patient with the fear that he may not be able to cope with it. This can happen particularly in elderly patient, psychologically disturbed patient, socially isolated patient. This breaking bad news, the technique and whom and how, it differs from patient to patient. It depends on the psychological build-up of the patient, his previous experience of the disease and family support. So, different history of the patient, like his or her children are unemployed, his daughter is not married, his house is mortgaged, or he has to pay many loans and taxes. In this type of patient, he is definitely worried about his future and about his family, about his children and so on. So, one has to be very cautious and take the patient in confidence, try to know all his social and financial background, and then plan this breaking bad news discussion. So, having breaking bad news must never be professional, that patient or his family detect little individual caring and compassion. So, while doing breaking bad news, one should be very compassionate with the patient and family. It is not a professional dialogue that you just tell the patient, oh, you are having cancer and you have to undergo treatment. It is not like that. Third aspect, psychological problem in cancer patient is depression. All the time this question haunts them, that why I am suffering from cancer, and this can lead to various grade of depression, various level of depression in this cancer patient. After knowing of life threatening diagnosis, patient may have physical symptoms like pain, nausea, side effect from medical treatment and difficulty in performing their daily routine. Symptoms of depressions are somatic and psychological, and they may have fatigue, insomnia, loss of appetite, loss of interest in surrounding, and many more, and loss of activities. And sometimes this can lead to suicide as well. Family conflict is also very commonly seen in cancer patient. Cancer diagnosis not only affects the patient, but the family as well, as here near and dear one has to constantly support the patient for his treatment, for his care, for his medicine, for taking him to hospital, and many more things. A family focused intervention and promotion of family unity is recommended to help improve family relation. That is why in palliative care we are treating two patients. One is patient himself and one is family member who is taking care of the patient. So, the family member is also equally important. We communicate with them, we try to understand their problem, try to solve their, and empower them to support the patient for his treatment and for his care. A family or couple psychotherapy should be done by a multidisciplinary team, and family members must be carried along in the informative and decision making process during the course of treatment. So, they are always part of a team. Palliative care is given by a team which includes a doctor, nurse, psychologist, patient and family member. The most challenging aspect is giving palliative care to disabled person. The psychology of disabled person is totally different than the normal one. They are more aggressive, they have very less coping mechanism, and they cannot accept the facts as they are, it is taken up by a normal person. Many a times disabled persons are paid very little attention, particularly when they are sick or when they are nearing the end of life. And that is why these patients do not function normally, both physically and mentally, like a deaf and dumb patient, visually impaired patient, unable to walk, and patient with emotional disturbances. In such condition, the caregivers and family member should give all types of support to this patient. In our hospice, we do get disabled patient, like we had one blind patient and another blind patient who had partial vision was called to take care of that blind patient, because they only understand each other's requirement, their needs and their psychology. Family members should not let the disabled person feel that he is being neglected as far as possible, and should encourage him to take courses on advanced communication skill and involve him in making family decision. So, psychological aspect of cancer patient is important when they are first time they are told that they are suffering from cancer. It is important when they are undergoing treatment for the cancer, and it is most important and challenging when the patient is a disabled person. Family member is a part of team who should be constantly present in all the decision making and while treating this cancer patient. Thank you.